Young children are more vulnerable to diarrhea and skin allergies induced by global warming. Thus, proper health hygiene is essential for them. In an exclusive interview with SKTV News, child specialist of Angel Children Hospital and Vaccination Center, Uripok, Dr. Taurem Yaikomba Kuman, stated that infants and small children are suffering from diarrhea and skin allergies caused by states' abnormal rise in temperature. However, parents need not be panicked as these are viral infections. He mentioned that hand-foot-mouth disease could be treated within 1 week without medicines, but it requires proper health hygiene. He suggested the parents to provide ORS and tiny dose of paracetamol to their children if necessary. Dr. Yaikomba further urged the people to be aware of and take precautions against vector-borne diseases.
Masi ayamana viral ngakani virus na thon mane aduna koina antibiotic ki thon role leite asli da koina parents in na koina to bigada basi ngasai gi angang si immunity kankhalan ba haibti sai chaba thakpa phahan ba dagi khoi lu nan ba niom chumna phajana matam chana tuman ba sumo myam sine hena maru oi oba phaiba to ba matam sida koina any antibiotic thabe mahuta sai gi ORS haiba posi amna koina hena focus to honi kaino ORS si kankhan na ba khaktan te ba khwaidi mai main role sin sai gi diarrhea du phan mane ba aduna any angang na diarrhea to ORS pitak pahijina parents ki da ko sidama wakanda leheningi adinga sagi hojiki fugri kanna santoiba hand foot mouth disease na hojik kanna santoiba si kaisu kiningai lite si santoga koina parents na panic oi gedom nate si karim tawdraga su hida karim thadraga su numit tare ni nipani manungda soidana phagadaba anabani except magi chinda pokthob ni na thuppa nabagi angang na chau thau yadaba dudang kitang angang sina thupoidaba mongda naroidaba mongda sadaba pochai ade masala thakdaba thum yaudaba pochai yaragadi at least mahi khakto oiraga su si pithakna honnabiba